Hi, Dr. Kevin. It's been so long time actually, yeah? I haven't seen you. I've seen two of your patients today. They seem really happy, all the procedure. So can you tell us a bit more about their details and treatments?
Sure. The first lady, Finden, is a patient, and she came in with her daughter. She didn't speak much English, but her daughter was able to explain everything sufficiently. And a lot of people have this misconception when we talk about the other patient who's even older, that when they get to a certain age that old people always have back problems. And this isn't true, that people can age quite nicely without back problems. And if they get back problems, the back problems are not due to getting old. The back problems are due to other problems, which are the same problems that people suffer with for many years, whether they're even children. We treat children, babies, young people, 20s, 30s, you know, and I treat older patients. I treat people in their 90s. So age isn't really a barrier or an obstacle in terms of having treatment. It's about identifying what the actual cause of the problem is and then treating that problem. In Finden's case, the problem was specifically to do with her spine where, and this is most cases, that it's more of what we describe as a functional or a biomechanical problem where it's related to the position and movement of the spine, where if the spine is out of position or moves, that we end up with irritation and pain caused by pressure around the nerve that can create muscle spasm and changes in the spasm and the tightness in the muscles, and that by manipulating and moving the spine into a straighter and more aligned position, we take the pressure away from the nerves and reduce the spasm and inflammation associated with the muscles, okay? And that, in her case, for example, she came in with quite severe pain in her lower back on one particular area. Her pelvis was moved and twisted as well, but through manipulation, we were able to fix that, and we found that she had another problem in her neck. She didn't mention in the earlier part, and once her lower back had been fixed, we're now dealing with some of the neck problems, and she's doing really well. She's progressing very well, and she's obviously quite pleased, and she's smiling a lot more because she's happy with the treatment, and she's not in pain like she was before. She's very happy, as fortunately a lot of my patients are. Ali is an interesting one. I treat Ali and his daughter, interesting enough, because she saw how well he was getting on with his treatment. She's had problems for many years and suffered badly, and she's been an interesting case as well. But with Ali, it was incredible because when he came to me, he did look like an old man. He came in, his posture was bad, he was hunched over, he came in walking with a stick. He was very struggling. You could see the pain in his face. But he had, again, what I established to be a mechanical problem, a structural problem, a functional problem, not a structural problem. And the doctors had done nothing for him, the GPs, the NHS. And this is the problem, not just in this country, generally, that when you get to a certain age, the doctors will be quite happy to just give you medication and say, this is because of your age, you're just going to have to learn to live with it. And this isn't true, because in most cases, in a lot of cases, patients that will come to us, we can identify where the problems are. And in Ali's case, we found, again, he had very similar problems that Finden had, where his spine had moved. And once we start to manipulate both his back and his neck, we were getting brilliant results. And now his pain levels, when he started, he was about a 10 out of 10, which is the maximum amount of pain someone can have, constant all the time. Now his pain levels are a 1 or a 2, and there's sometimes when he has no pain at all. And this is a gentleman, when he first came in, when I asked him to turn his head, he was actually unable to go even just a little bit. His movement was literally like this. Now he has complete movement. He can turn and have his chin right over his shoulder. He's 76. I mean, we've given him a new lease of life, and he comes in, he's practically dancing when he comes in. He's skipping, and he's just a happy man in that. It's changed his whole life, and he's so, and now we're working with his daughter, who I know he did an interview, but she's done really well. She's got pain down both arms, down both legs, and she's suffered with this for a long time. A lot of it is to do with her work and just physically. And I know a lot of my patients in the Kurdish and the Turkish communities, they do physical jobs. They work in restaurants, they work in shops, they stand for long periods of time, they're bending and lifting. Even the women at home that don't work, perhaps, they're also cooking and cleaning and doing hard physical labor all the time. And as a result, they're putting a lot of pressure on their spine, on their lower back, and on their neck. And this is the answer. We have the answers here because we can treat, we can manipulate, we can massage, and by getting rid of these problems and the pressure away from the nerves, can clear out a lot of these problems and give these people back a normal life, a healthy and a happy life, and a pain-free life as well, which is important. And of course, there are some cases, not many, but there are cases where we might need to consider injections or MRI scans, and we can arrange that, and we do that here as well too. So we can provide a lot of care for a lot of patients. Anyone who's suffering, I would urge them to call us, make contact with us. You probably know people that might have been here. We've been treating the community, as you know, for a long time. And contact us, and let's see if we can help you. And we'll tell you honestly, and in most cases we can, and we can make a difference in your life. That's what it's all about.
It's all about love.
Yeah, exactly. Yeah.
Thank you very much.
Thank you very much. Thanks, Evgen. Yeah.